All right, welcome everybody. So excited that you're here. Welcome to the Art of Healing with your host, Dr. Judy Jasek of Animal Healing Arts and Matt Rowe of ParsleyPet. During our show, we are talking about your pet's health, raw feeding, and alternative treatments for cancer, unexplained illnesses, and supporting your pet's natural ability to heal. Welcome, Dr. Judy, to this week's show.
Thanks, Matt. Always happy to be here, even though this is going to be a little bit of a heart-wrenching show, but I think it's going to be, I think it's going to be some really good information for people.
I want to thank you so much for opening your heart to everything that has happened over this past week for you and one of your loved ones, and sharing that with this audience, and also helping them potentially transition in their own life through their own pet that might be going through something, that might be suffering, or and that question always pops up. I know with my, I had Doc. Doc was my baby. And when I had to say goodbye to Doc, that was my number one question. I remember going to multiple appointments with my veterinarian and having the discussion, when do I say goodbye? When is this moment happen? And that's what we're going to talk about today. So, Dr. Judy, would you like to start the show giving a little bit of background of what happened this past week, if you feel comfortable doing so?
Yeah. So I lost one of my own pets over the weekend, and it was really quite sudden. And, I've been a practicing veterinarian for several decades now, and I'm pretty good at picking up on clinical signs. And one of my little dogs, it started with her just getting real picky about eating, but that was kind of her personality because she was a princess and she'd dance around the food dish and see what her brother was eating and see if she could get treats instead of eating her dinner. And, she'd play a lot of these little games, but it became more and more persistent. And I always, when I go through things with my own pets, I really, I'm no different than anybody else when it comes to my own pets. Your emotions take charge, and it's very hard, if not impossible, to think logically. So I literally have to sit and think, okay, if this were one of my patients, what would I be telling the people, the pet parents? And what kept echoing in my head, I always tell people that when pets quit eating, it's not a good sign. Pets eat, and when they truly just lose interest in food, there's something substantial going on. And for her, by the end of the week, she really wasn't touching it. And things that I'm like, okay, I'll spoil her rotten, I'll feed her anything she wants. And stuff that normally she would have just home cooked food, whatever, she would have just gone crazy about. She wouldn't even touch it, or she'd touch it one day and then wouldn't eat it the next day. And I know I haven't gone through that with my patients. This is what happens. They have good days and bad days, and they eat something one day and then they quit eating it. And so we went through that. And then I noticed that she was breathing heavier than normal. And I discovered she had a heart murmur. And it's, a holiday weekend. And I do have, my little clinic here in the house, but I don't have an x-ray machine. I couldn't take a chest x-ray or anything like that. But she's also a little dog that is so resistant to handling. She doesn't I can't treat her with, if she's ever been sick and I have to treat her, it's a nightmare. She just fights it and holds a grudge and gets so angry. And to have somebody else be handling her and trying to get testing done, I knew it would be just torture for her. As a holiday weekend, it would have meant hours at the ER, which I would have done, but it would have been just torture for her. And she was already having trouble breathing, and she was going downhill so fast, almost hourly. I could see a decline. And I just knew, this is a 15-year-old dog. And when a perfectly healthy dog at that age just starts to nosedive fast, I knew, I mean, this is where having my background does help as compared to people that just haven't worked with lots and lots of pets over the years. I knew it wasn't going to be good. I can go push trying to find out, but I knew it wasn't going to be good. Pets don't go downhill that quickly if it's not substantial. So she continued to decline, and by Monday afternoon she was starting to turn blue. I kept checking her color, membrane color in her
Mhm.
mouth, and she was struggling more and more to breathe. And so I ended up assisting her
Mhm.
transition. I knew it was the kindest thing to do, and that's a mixed blessing, it, having the ability to do that. Because then again, it's like she will hate having anybody else handle her, and as hard as that is to help your own pet's transition,
Mhm.
um I didn't want her to just suffocate. She
Yeah.
was rapidly losing the ability to breathe, and so I assisted, her transition. And that was, you know it's always one of the hardest things I think you can do as a veterinarian. But I knew in the moment it was the right thing. We were running out of time, and I just made those decisions. So I just thought maybe we could hit on a few points about what are the things to look for in your pet, and how do you know when when it is time to make that call.
Mhm. No, and I think that anything we can do to help other individuals, because it's a fact of reality. In many cases, we outlive our pets. And with that is there's only one constant in this world, is that our pets will not live forever. We will not
Mm-hmm.
live forever. And it is something that is a reality of our lives, but it doesn't make it any easier,
No.
especially when you had to do what you did in transitioning her in those moments. So let's talk about that a little bit. You said you had noticed a decline. What are some of the things that you as a veterinarian started to take a look at? We're like, well, that's a sign. That's a sign. And what are a couple of those signs so you can help all our loyal, followers that do watch the show, how to, helping them in this moment?
Well, I think, when pets, their behavior changes. So the first thing, so
Okay.
we were out of town, not this past weekend, the weekend before the fourth, we were on a
Mhm.
camping trip, and the pet sitter had texted me a couple of times and said, "Oh, she's acting a little off.
Okay.
Not really eating. She's hiding upstairs more. She's not really interacting like she normally does.
Mhm.
She's kind of giving me some funny looks when I wake her up." CJ couldn't hear much, so when she was sleeping, you had to wake her up.
Mhm.
And the pet sitter said, "Yeah, she's just acting kind of different." And I said, "Well, okay, CJ was a drama queen, so sometimes she could act differently just because of hurt feelings, but behavior changes. When pets, I mean, they're, for the most part, they're creatures of habit, and they do the same things over and over and day in and day out. And when their behavior changes, they normally interact a lot with the people in the household. All of a sudden they're
Mhm.
not. They're hiding upstairs, or they're interacting more. It can go both ways. Now, CJ was the type that when she didn't feel good, she'd go off by herself and isolate. Some
Mhm.
pets become more clingy. So they're like, "Hey,
Mhm.
something's not right in my body. I think I might need some help here." So any kind of behavior changes, your pet better than anybody else. So don't
Mhm.
ignore behavior changes. There's a reason for it. And it doesn't mean that every behavior change means your pet's dying, but it could mean they're in pain,
Yep.
or something is going on with them. Another thing I noticed on CJ, she started shedding like crazy. Like, I knew something was going on with her body. And you might say, yeah, pets shed, but I mean, this dog has been raw fed her whole life, always been super healthy, had a beautiful coat. Now, like, her hair is just like coming out in clumps. Like,
Right.
okay. So the body will always favor the internal organs, the more vital organs, and the skin and hair coat kind of suffer the nutritional losses if the body is, if there's not enough to go around, you're going to see the adverse changes in the skin and hair coat first. And so I noticed that going on walks, so I have another little dog that's about the same age, and he's actually showing his age more. So on walks, like he's really slow, like we go very slow. We call them sniffs, not walks, because you just go out and sniff around for 10 or 15 minutes, then he's ready to go back home.
Yeah.
Well, CJ was out there like, come on, let's go. What are you guys waiting for? Like, what's taking, And then the last week, she's the one back behind dragging. All of a sudden, she just couldn't keep up. And my dogs love to go for walks. I'm like, And I'm starting to put all this kind of together in my mind. There was no vomiting. She did have a little soft stool. So I was kind of keeping an eye on that. Sure. But then the breathing, when I noticed that she was just kind of starting to huff and puff to breathe. And then, of course, I had the ability to listen to her chest and detected a heart murmur, which she's never had. So that I know was new. She had a teeth cleaning just last year, and I know everything was fine then. And so something, definitely changed in her body. So one of the things I tell people, appetite is a real key indicator. When dogs stop eating, that's a big sign. And if it's a young dog, young, healthy dog, and they quit eating, and I'm not talking about missing a meal or two, days, 3-4 days where they're not eating, you got to get it looked into. A young dog, it doesn't mean that it's always life-threatening. A young dog could swallow a foreign body. They swallow rocks, corn cobs, all kinds of weird stuff. But when a dog just completely quits eating, I'd say for longer than 72 hours, then you better be getting them checked out, because something is going on in their body, for sure. That's a real key indicator. And I think evaluating pain, I really want to touch on that. It's a very hard thing to do. I was talking to a client last night whose dog has lymphoma, and she said, I think he's in pain, but I don't know. And so we talked about a lot of these things. The dog isn't eating or drinking, isn't getting up, moving around, very weak, has very large lymph nodes. And so signs of pain. One would be panting. So when dogs pant a lot, that can be discomfort. It can be anxiety. But when dogs all of a sudden start panting a whole lot more, something's up. They're not feeling good. It could be if there is any respiratory issues going on, they could be trying to get more air, or it could be pain, could be distress. So that's something to pay attention to. And lack of activity. When dogs don't want to get up and move around and do the things that they normally do, it could be weakness. In the case of CJ, it was her heart. She just wasn't getting enough oxygen to her body for her body to feel like it wanted to do anything. But pain anywhere usually is worse when pets move around, so pets are going to lay still if they're hurting. And I think there's almost like a look that they get when you just know they're not living life anymore. They don't have that sparkle. Like even CJ, those last 2 days, she'd have moments where she'd be like, oh, hi mom, let's have a treat, and then she'd be like, yeah, no, just kidding. But you'd see that little spark, that normal look in their eye. When that really goes away and you just don't see that anymore, that's a sign. And that's subjective, but I've told so many people that I don't have a definitive, answer for exactly how that looks, because it's going to vary a little bit from pet to pet. But you can tell when the life's gone out of their eyes. And I think that's a key indicator. And I think that's a real important time to really ask yourself, okay, am I keeping this pet alive for me, or would it be more fair to let them go, because their quality of life is gone when they can no longer do the things that they love to do, whether it's going for walks or playing ball, and certainly the eating. None of that stuff is going on, then I think we really need to be taking a good hard look at, is it fair to let them go on? And then, get an assessment. Have, a lot of, I know here in the Denver area, there are services that do home euthanasias. There's a number of them actually, and they will come out and do an assessment. And you don't have to take your pet anywhere. You just call and have them come over, because when your emotions are involved, I mean, like I was saying before, it's almost impossible to be objective and make good, objective, logical decisions. And it's tough. And there's a lot of guilt involved. Am I making the right decision? Am I doing this too soon? Should I be trying something else? And I think getting a caring professional to help you with that assessment is definitely a good idea. If you go into your average vet clinic, I find, sadly, they're very quick to just euthanize them. But I think these services that do the home euthanasia are much more compassionate and caring, and will help you think through the process and help make that decision. So I would suggest doing that, because I've also seen pets that I have felt that people let go on too long, or longer than I would have, because the pets were suffering. They just couldn't let go. But, again, I think you have to really ask yourself, am I keeping this pet alive for me because I don't want to say goodbye? And I get it. It's so hard to say goodbye, but then is that fair to the pet? So I think you need to be, able to ask yourself those tough questions.
Yeah. And I think you made a very important point, is your pet. You know your pet better than your vet. When that spark leaves their eye. I know, when I had to put Doc down, there was a moment. She was holding on. She still loved the ball, wasn't as interested in chasing after it, which was fine. She was getting older. But then there was one day, I remember coming downstairs and looking at her, and she looked up at me, and you could tell, like, intuitively, it was either deep within me that I knew, or that it was her telling me through her eyes, okay, it's time, Dad. And it was the hardest, gut wrenching, as you very well know, as you went through it here in the past week. But as a pet parent, your pets so well. Their idiosyncrasies, what excites them, different habits that you do that they start to get excited about, like when an alarm clock goes off and they know that breakfast is right around the corner and they're coming and bugging you, and all of a sudden that doesn't happen anymore. And it's something that in the back of your mind. But then you bring up another good point. Do we keep our pets alive and going through that for us? And we kind of justify holding on to them as long as we can.
Right. Because it's hard. You don't want to say goodbye. And another thing I just thought of, we talked on a previous show about, pets being given kind of the other side of this coin, where they're given these really poor prognoses, or these, they're, you're told that your pet's going to die. And I've talked to these, pet parents, and they say, well, my pet's acting normally. How can my pet be dying? So as the other side, again, you're looking for that behavior. And that's why I bring that up. Here you have this diagnosis, or you've been told by a veterinarian, your pet has this really serious disease and they probably just have a month to live, and you better just get ready to lose them, but they're acting perfectly normal. Look at that behavior. It doesn't matter what the diagnosis is. With CJ, I didn't even find out, and I still don't know. And the medical professional in me desperately wanted to know, but I knew it would be way too hard on her to find out. And does it really matter? No, it didn't to me, because I was watching my dog and I knew she was going downhill. And I felt like my most important role was to not let her suffer. So that motivated me to take the actions that I took. And I'm glad that, that was the approach that I took. It's always awful to lose them. It doesn't matter whether it's right, or whether it's right, or all the justifications in the world. It's still hard to lose them, but at least I felt like I didn't put her through some very stressful events at the end of her life. She was here at home doing her normal thing until I knew it was time. So watch that behavior, and really trust your gut, trust your intuition. Like we were just talking about, your pet better than anybody else.
Yeah.
And you're not going to, you don't want to take that step unless it's necessary. So something's tugging at your heartstrings saying, I don't think this is fair to let them go on feeling this way. You're picking up on some signs from your pet. And so pay attention to that.
Yeah. And that's it's such a beautiful point, is you pick up on these signs and what's going on with their bodies, and what's going on with them, and listening to your heart through these moments and really digging in and saying, what, like you had done, this is right. This is, and you knew it deep down. And so even with all the medical training that you've had, with all of these moments, doesn't make it easier, but you knew you did everything that you could. And so many pet parents out there, and like you said, what I love is have somebody come in that doesn't provide additional stress for your dog through these moments, and have them do an assessment. It's an assessment from some side that is not a clinic that's like, yep, they're going, let's move past them, go get another one. Something that is somebody that's really going to take time with you and talk to you about it and assess and do what you did for your loving puppy and all of that stuff.
Yeah. I mean, getting an objective viewpoint, I think that can really, really be valuable. And I also feel that, with CJ, I think the best we can hope for when our pets pass, actually, that when I go downhill, I would want this, that it just happens quick. Like she was, it's shocking when things like this happen suddenly and you just don't really see it coming. But then when I think about, well, she had nearly 15 years of a healthy, vibrant life.
Right.
And the end came quick. I mean, really, her decline was in about a week. And to me, there's a blessing in that, even though it's shocking. I know the last thing I would want to see one of my pets go through, or for me to go through, is months and months and months of pain or chronic illness where you're suffering and you can't do the things that you want to do. That would be the worst. I spend a lot of time outdoors. We love to camp and hike, and people say, "Well, aren't you like afraid?" And like, afraid of what? Like, if I had a mountain lion kill me out there in the hiking trail, I'm like, hey, they're just hungry. I'm out here doing what I love. I mean, there's way more. I'd rather go that way than be killed by a drunk driver on I-25, right?
Yeah.
Like, what's the sense in that? To me, that's
right.
kind of useless. But going relatively quickly, I think is a blessing. So even though it's a surprise and a shock, I think long protracted illnesses, and this kind of goes back to not keeping your pets going for you when they've lost their quality of life, they can't get up and move around anymore. I think it's time to really consider letting them go.
Yeah, absolutely. And when we make these transitions and that type of stuff, but you know, like you said, it's a blessing to go quick. Um, it's a blessing not to suffer, because like I said earlier, we can't stop death. We can't stop these moments and for ourselves, and we can't stop when it is our time. It is our time to transition. And so you helped CJ so beautifully transition through this, but also gave her that grace to not let her suffer in these
Mhm.
moments. And you knew it deep down that this was the right thing to do.
Yeah. And, that's something else that we do help people with. I had a phone call just the end of the day yesterday. We had this exact conversation. The dog's failing. They want to know when's the time, what can we do? And so, if you can have somebody come evaluate your pet, that's great. But, we can also do some of that on phone and Zoom too, if
Mhm.
you don't have that available, or you can't get somebody in quick enough to do that evaluation. We can also help you with that assessment.
When you made a really another good point is having somebody to talk to about it, somebody that's objective on the side, that is not, emotionally tied into these moments, but somebody that you can call like Dr. Judy and say, okay, this is what's going on, and somebody that's going to help you process through this potential loss that may be coming up, and really be able to talk about it, and really be able to release what is going to happen. And in there, I think, is so much grace and love and acceptance, that it is beautiful on that side of what you did and what you do for your clients, especially the client that you had last night, that you helped her mend herself, if that makes sense. Because it
Mhm.
is a part of us. Our pets are a part of us, that they are family, they're so close. And when we have to say goodbye to them, it feels like a piece of us goes away.
Oh,
And it's,
totally. Yeah. Like a just a big
mhm,
part of your heart's missing. Yeah.
yeah, that you've given so much love for the last 15 years and so much care, that at some point you're like, okay, this is time. So, but to have somebody to talk to about it. So definitely, if you're going through this moment, do not do this moment alone.
And
Don't.
maybe seek
Mhm.
out advice elsewhere than Facebook and
Yes,
stuff. Just saying.
yes.
Get professional advice.
Our show is wonderful. And yes, and hopefully, and with this show, what we want you guys to take from it is
This show exempted from that.
100% exempt. Um, but really in this moment, is our intention today is to pay attention to how your dog is acting. You know your dog better than anybody. And then take that next step to talk to somebody that is going to talk to you about it. Not make a quick knee-jerk reaction of saying, oh, hey, your dog's sick, this is what's happening. And just really just kind of, they lose that empathy. They lose that moment to listen during a very difficult time. Find somebody, find a good holistic veterinarian, call Dr. Judy. She does great telemedicine. And you're really having a moment to where somebody's going to walk you through it, and really take the time to walk you through it. And it's such a freeing aspect, because as you said, you knew something was wrong. You knew
Mhm.
it was time. So then that doubt in the back of your mind, or did I let them go too quick, or those questions that come up, because I've had them, and where somebody just gives you a quick answer. This is not a time for a quick answer. This is a time for a conversation, to really walk through it, and to see, making sure that for yourself, you have that closure.
Right. Right. And it's about the pet too, not about a diagnosis, not about well, it's a this or a that, or, I mean, like I said, as a medical professional, I really wanted to know what was going on with CJ, but I knew that the diagnostics would be torture for her. So I opted not to do it. And I still don't know, but I still feel like I did the right thing. So it's not about it's this diagnosis. So this is the appropriate action. learn to look at your pet. You know way more about your pet than you realize. You just have to get out of your head and look at your pet from your heart's perspective, and tune into their energy and trust your gut and trust your intuition.
Yep.
Because you do know, and I know I've heard so many times where people come in and they say, I knew I shouldn't have done this. Like, I shouldn't have given that vaccine. I knew that wasn't the right thing for my pet, but that was the advice I was given and I did it anyway. And the point of that is, if you're paying attention, we all have very strong intuitive powers if we allow ourselves to recognize them and pay attention, because they're not wrong. That, our heads will screw us up because you're, logical thought, you're going to go out on Google and research and hear what a bunch of other people have to say. But bottom line, and it's not that it's bad to get information, but when it comes to yourself or to your pet that you are so in tune with, really trust your intuition. It won't be wrong.
Right. 100% it won't be wrong. So thank you, Dr. Judy, for opening up to us today and talking about CJ. And I know CJ is in an awesome place, and wish you the best during this time. So thank you again for having this conversation with us.
Oh, you're welcome. I hope it helped shed some light on this topic for people. And I know she'll be back one way or another. She'll come back some other form, or her spirit's still here. Her body's gone, but her spirit's still here. So if 100%. that's my belief, and I do find some comfort in that. That may not be everybody's belief, but I do find comfort in knowing that her body's gone, but she's still here.
She's still there with you.
Mm-hmm.
Yeah. And she wants you to go on and live an incredible, all these moments. And she has so much love she's pouring down on you, and that she's with you in all of this. So thank you again. I really appreciate it.
It's my pleasure.
Okay. Well, a little somber of a show, but I think so important. So thank you guys so much for watching us today. And I hope that you guys have an incredible day, with a happy, healthy, loving pet, no matter what case that it is.
Go take your pets out and do something fun.
Yeah, love on your dog right now. It's so important. All right, we'll see you later, Dr. Judy.
Bye, everybody.
See ya.